Hi, my name is Jody Wider. I'm a nurse at Maine Medical Center, and this video is on lead poisoning. Lead is a heavy metal. It is found in paint, car batteries, weights, bullets, and some water pipes. It can also be found in some imported products, such as children's jewelry, painted toys, and folk remedies like Azicon and Kohl. Children under the age of 6 years old are most at risk for lead poisoning. Children within the ages of 1 year and 2 years old are at highest risk. Adults can get lead poisoning as well. Certain professions can expose people to lead. People who work as fishermen, painters, plumbers, and mechanics, as well as people who have hobbies such as stained glass making. Exposure to lead is usually from inhaling lead dust or ingesting lead chips from flaking, peeling paint in homes built before 1978. Remodeling an old home can produce lead dust and chips. In Maine, 60% of the homes have been painted with paint containing lead. As the painted surfaces age, just opening and closing windows and doors can create lead dust. Lead dust can also be produced by regular use of painted floors and stairs. Lead can also be found outside an old home in the soil as the paint chips and flakes. If lead gets into the body, it can do permanent damage, causing developmental delays, behavioral problems, hyperactivity, lowered intelligence, hearing problems, and slowed growth in children. What can you do? If you live in an older home or apartment, you can check all the windows, window sills, doors, stairs, railings, and all other painted surfaces to see if they are in good condition. If you have concerns about lead paint and are renting, contact your landlord immediately. Lead dust is not always visible. You should regularly clean doors, window ledges, and floors with warm water and detergent. Clean from the top, working down to the floor. Rinse often and use disposable rags or sponges. Wet mop the floor using a 2-bucket system, one with detergent for cleaning and one with warm water for rinsing. Vacuum the rugs and the furniture using a HEPA filter vacuum. If you do not have one or cannot get one, wet wiping all surfaces with warm water and cleaning solution will help. Throw away your cleaning rag or sponge after cleaning each room. A public health nurse from your city can help you get the cleaning supplies and HEPA filter vacuum. Use duct tape or contact paper to cover any cracks and peeling paint on doors, window sills, and walls in your home. If there is flaking, peeling paint on the porch or stairs outside of the house, leave shoes at the door so the paint is not tracked into the house. Children's toys, stuffed animals, bottles, pacifiers, and bedding should be washed frequently. Make sure the child washes his or her hands before eating and before bedtime. Eat a diet high in iron and calcium, such as meats, beans, spinach, milk, yogurt, cheese, and other low-fat dairy foods. If family members work or have hobbies involving lead, they should change clothes and shoes before entering the home. You may not know if your child has lead poisoning because most of the time the child does not have any symptoms. Some symptoms of high lead levels include stomach aches, vomiting, headaches, fussiness, and seizures. Contact your child's doctor if you have any questions about lead poisoning or if you would like to have your child tested for lead. For a lead test, a small amount of blood must be taken from the child in the doctor's office. The blood sample is then sent to the Maine State Laboratory for testing. It can take up to 2 weeks for the lead results to be reported. If your child has lead poisoning, your doctor will help you with what to do. Most of the time, the lead will leave the body naturally. If the level of lead in the body is very high, medication may be needed to help get rid of it. If you are concerned that your home may have lead paint, do not remove the paint yourself. If you need more information about lead paint in your home, you should talk with your landlord, your public health nurse, your doctor, or call the Maine Childhood Lead Poisoning Prevention Program. Lead is harmful to the body. We can help. Call Maine Childhood Lead Poisoning Prevention Program at 207-287-4311 or 1-800-698-3624, or visit us on the web. Kids Run Better Unleaded at 207-662-4982. Maine State Housing Authority at 1-800-452-4668.